And we are now live. Good morning, everyone. We are happily one of the first sectors allowed to work. This comes with some relief, but also with many challenges and responsibilities, especially from an employee perspective. Some employees are hesitant and fearful of returning to work. Some employees have young families and can't find childcare. Sometimes families of your employees are fearful. On the other hand, maybe some of your employees do not believe that COVID is serious and won't comply with your health and safety protocols. This webinar is all about navigating your workforce during COVID while staying focused on health and safety. Our guest is Natalie Hansford from EIO Solutions. Alan White, Dave Wright, Jeff Olson, and Peter Ganane from Landscape Ontario's COVID Task Force will be on hand to share ideas and answer questions too. Some of the questions the panel will be discussing are, how do you implement safety protocols? What happens if your employees don't feel safe? How are you dealing with employees who have childcare issues? How are you dealing with public and media scrutiny? How important are optics? What do you do when employees are sick? How to mitigate the risk of COVID outbreak in your operation? How do you encourage compliance with your safety policies? Lots of questions to answer. And as always, please submit your questions in the chat box too. Without further introduction, let's start with Natalie Hansford. Natalie, perhaps you can tell us a little bit about EIO and your role in it.
Yeah, absolutely. Well, thanks for having me on, everyone. It's a delight, especially because the snow's all gone, so the sun's out, which is great. Well, my role at EIO Solutions, and EIO stands for Employee Investment Optimization. So more than recently, we've been really focusing on HR and health and safety and making sure employers know exactly how to protect their workforce and themselves against COVID-19. But as in all, what we do is we help employers making sure that they're able to put their money in the right spots when it comes to employee investment and making sure that they have all protocols to protect themselves and mitigate themselves from liability, especially during these unprecedented times. So basically, what I've been doing more than recently is I've been hosting our weekly webinars and just updating and giving all the knowledge that I have to employers to making sure that they know how to handle these situations. So we know that every industry is different, every company is different, and you do have to take that into consideration. So we really like to look at the workforce on its own, separately from each individual company, and making sure that you're implementing the correct policies and procedures. So for example, one policy that might work for Landscape Ontario might not work the same thing for Wright Landscaping. And that's just because of the different employees that are in the workforce and how they're on site or maybe not on site. So I know that during our webinar that I had, which I think a lot of the participants in this webinar right now were actually on that webinar, which was great. And we were kind of using an example that a specific company in Ontario had an outbreak because of COVID-19. And this company ended up having to close their entire workforce because they had over 40 people test positive for COVID-19. And they really didn't know how to deal with it. They didn't know how to handle it. They didn't have those social distancing practices in the workforce. They did maybe in the plant, but not when they're on lunch breaks or when they're on smoke breaks, or they actually had some housing that employees were actually staying at as well, that they weren't actually following the same processes. So again, that company would have to use a completely different policy for companies that may be on site with 5 workers. So we like to take that into consideration and making sure you have everything in place so you feel protected, but also so your employees feel protected. Because the main thing is that as long as you're giving them all the information that they need, you can make a business decision, but the employees can make a decision that's going to help them protect their families as well. So in a nutshell, that's kind of what we've been focusing on for at least the last 2 weeks, but also as a whole. But yeah, I'm excited to answer any questions that you may have and help you guys protect yourself and your workforce. So would you like me to do the share screen and add the presentation?
Yes, so let's start with your presentation.
Yeah.
And that'll stimulate some questions.
Great.
And then we'll go to the other COVID task force members to talk as well.
Okay, great. Okay, so what I really wanted to focus on today is explaining the 3 steps of compliance during COVID-19. And this is one of the main questions that we get because you really truly don't know how to implement something. So there's one way of actually implementing or having these policies on your shelf and kind of letting the dust build up, but it's another of actually implementing it and maintaining the system. So I'm going to go through each step and what exactly that means. And that way, when you have all the information that you're learning through all these task force meetings and other webinars that you may be joining during COVID-19, you actually know how to implement them properly. So if the MOL were to do a surprise visit, you know what to do and how to handle it. So the first one is develop policies and procedures, making sure you actually have the mandatory policies and procedures in the workplace. And like I was saying earlier, every company is different, so please take that into consideration. I'm going to kind of give you some hints and tricks depending on the size of your workforce throughout this webinar. But again, making sure you actually develop those policies and start to implement them in the workforce. So yes, 2 is implementing COVID-19 and employment policies and procedures. And the reason why I kind of separate the 2 in number 2 is that you can't forget about all the other policies and procedures that you actually require as an employer on site. So we all know the Ministry of Labor has been knocking on doors and going on sites and doing visits on a daily basis. And a lot of people are just thinking that they're only looking for COVID-19, social distancing, and all the other stuff that you have to have implemented because of COVID-19. But that's not true. They're looking at everything as a whole. They're going to ask you where your health and safety board is. They're going to ask where your joint health and safety representative is. They're going to ask you where your health and safety manual is. And if you don't have those things on site, that's when they really start to really dig into what is implemented and why you're missing things. So we can't forget about everything else that we still need to implement in the workforce, but as well as COVID-19. And they all kind of mesh well together in making sure, again, you're protecting your workforce. Number 3, maintaining the system. Like I said, it's one thing to develop the policies, it's one thing to implement them, and it's another thing to maintain them, which I'm going to dive deeper into on the next couple slides. So let's go back to the first one, developing policies and procedures. So the government has issued industry-specific COVID-19 guidelines to require when reopening or while you're open. So again, you can go on the government website, so canada.ca, and they have a lot of different guidelines that you can look at depending on your industry and what they're required to put into the workplace. This is a requirement and it's mandatory. You will get shut down if you don't have these in place. So it's really serious and making sure that you put those things in place before you reopen, but also while you're opening and maintaining it. The next thing is company-specific SOPs and communicating to employees. So you have to make sure that you are communicating this properly to employees and that you're making sure that they understand. So recognizing that if you have to explain it in a different way, maybe they learn by doing, different things like that to actually make sure they understand what the policies and procedures mean and how to use them in the workplace. Company-specific SOPs, so safe operating procedures, mean that say you're doing social distancing in the workplace and you have to be 6.5 feet away from all employees at all times. Doesn't matter the circumstance. But let's just say you have to pick up a piece of equipment and it requires 2 employees and you are having to be 2 feet away from each other. You actually have to develop a safe operating procedure when you're within that within that period of time. So if you are lifting that equipment, you actually have to put a policy in place so that the employee might have to wear a mask. They might have to wear gloves. They might actually have to wear glasses within that period of time. So making sure you're putting that within place. So if the MOL comes on site and goes, why are you carrying this equipment? Why are you within 6.5 feet? And how are you going to make sure that the employees are safe while operating this? And then the next one is constantly develop or update policies and procedures. I even know for myself, I've been actually writing these COVID-19 policies and I've been updating them on a weekly basis. That means if you got your policy 3 weeks ago, it's out of date. So you have to make sure that you always have the most recent up-to-date policies and procedures. So that way, if they do come on site or your employees don't know how to handle a certain situation, they understand and they're communicated with the most up-to-date policy. The next one is implement COVID-19 and employment policies and procedures. So like I said, actually implementing it. So making sure it's short, simple, and clear communication. I slightly went over that in developing the policies and procedures. But this is just making sure that when you're writing your policies, making sure they actually understand it. Don't use big words. Don't use words that they're not going to understand. Make sure it's clear and simple. Step-by-step training. Develop and actually maintain this training. So for example, if they don't know how to put on a mask, show them how. Some people don't know how to take off gloves properly, show them how. They're not going to take it off by each finger and just ripping it off the hand. They actually have to making sure that they're not contaminating themselves when they're taking off their gloves. So certain things like that you may think are common sense, but are not. So make sure you actually have that step-by-step training, or have a poster and kind of go over this poster with them. So even washing their hands, as simple as that, you do have to teach them how to do so. Sign-offs and documentation. I know this is pretty simple, but it's so important. Making sure you do have sign-offs or indicating that it was communicated to the employees. It's not good enough just to say, I told them about it. Why aren't they doing it? You have to actually make sure that they recognize and they understand that this is in place, and they either signed off or you have attendance records that they were at that meeting when you did deliver that policy or procedure. And then the last one within this section, and I actually think it's the most important, is making sure your management team is up to date. These people are on site and they're managing every single employee within your workforce. Making sure they have the most recent and up-to-date information is extremely important. And the reason why is because they're the ones that are communicating with your staff on a daily basis. So they should be the first to know when you're implementing certain policies or what it means or how to handle it. For example, I know that we were talking about this before we went live, but making sure that you're very sincere when you're having a conversation. Say you have to send an employee home. Your management knows how to deal with that. You want to make sure that you're sensitive, but you're still being protecting your workforce and making sure that that employee is going home, but you're having that conversation that is a little bit more sensitive, because we all know that this is a very sensitive topic. So making sure that not only you know how to deliver that message, your management team knows how to deliver that message, because they are representing you, and that's something you really have to keep into consideration. So the last one here is maintaining the system. And out of all different steps, this is the most important thing, because if you have things in place and you're not maintaining them, it's almost like you didn't have it at all. And one of the examples I really like to use is that, say, for example, you develop a policy for workplace violence and harassment. You implement the policy, you get all employees to sign off on it. And then a situation happens and you need an investigation because there's harassment in the workplace. If you just put that situation under the rug, you don't deal with it, you say it never happened, you move on from it, you're not maintaining the system. And you're actually going to get in major trouble with administrative labor and even maybe legal. So just making sure you maintain the system, you actually follow the processes that you said you're going to, and also make sure that the employees trust you, because that way they actually know that you're serious with all the policies and procedures you're implementing, and they're going to actually build that trust with you. So update and review the policies on a regular basis and as needed. We always say look at every single policy on an annual basis. And for COVID, for example, I'd be looking at your policies on a weekly basis, because you never know when things are going to be changing. Annual training. So it's a requirement to have annual training depending on the different regulations that are required in the workplace, and making sure you're getting that training done. And we always say an unbiased third party is the best way to represent and implement these policies, because you can always kind of put the blame on them, and making sure it is an unbiased opinion. So we know a lot of the times when an employee is implementing a policy in the workplace, there might be a biased opinion about their buddy not having to do it because they're close with them. Oh, don't worry about it. You're my friend. You don't have to follow this policy procedure. Or maybe sometimes on-site HR people, when they work within the company, they do have that biased party because maybe the office staff doesn't have to follow that policy and procedure because they're buddies with them. So that way, an unbiased third party is going to be able to implement this properly, and making sure that it's completely unbiased. Everyone has to follow the rules, so it's fair and on par with everything that's implemented in the workplace. So the last thing I want to talk about, and then we'll open the floor to questions, is what if I don't do any of these things? What are my liabilities? So what if I do step 1, step 2, and not step 3? Or what if I just do step 1? What's going to happen? And if you've been on a webinars, we know that you guys know that we talk about this every single webinar, and it's really serious. The liabilities could be government fines. The liabilities could be work shutdown orders. Losing your workforce because they lose the trust and they don't actually think that you're representing them in a good way. Ministry of Labor audits and Ministry of Labor drop-ins, potential jail time. This is serious. If you're not following any of the rules, you can get potential jail time on site. Potential lawsuits. Your health premiums could increase because COVID-19 outbreaks. And then, of course, your company reputation. This is really serious and really important. So these are some of the things that you really do need to consider when you're thinking about all the different steps that I just shared. Okay, so I'm going to stop sharing here and I'm going to open the floor to questions.
So Natalie, what I'd like to do now is you gave us a great outline, develop, implement, and maintain policies and procedures. And I'd like to just go around to the COVID task force members and ask them from a practical perspective how they actually are doing with implementing their or developing their policies, implementing them, and maintaining them. So let's start with Jeff. Jeff, how did you approach this whole issue? Where did you get your policies from?
Well,
how do you implement them? Right? What challenges are you having? That kind of thing.
Many.
Okay.
Good morning, everybody. So we are fortunate that I brought in a third-party safety consultant about 4 years ago. We're a larger company, so we needed it, and we wanted an unbiased person to be managing our health and safety programs, because like most entrepreneurs out there, health and safety gives me a headache. Like, it's just not fun. It's boring. It's risk management. It's sort of like, no offense to anybody, sort of like HR. It's not exciting for entrepreneurs typically. So I was like, let me just outsource that to a third party, and for the cost of half a salary, this person came on board, retired gentleman who had been in the manufacturing space, came on and built all of our health and safety policies. And then when this came up with the COVID stuff came up, we handed that over to him as well, and he developed all of our internal policies. And so we have in our business like 4 or 5 unique situations. So we have a health and safety policy for our office area. We have a policy for our greenhouses and growing areas, the outdoor growing areas, the warehousing. That acts more like a manufacturing type of facility. And then where our contractors come and shop, how that's laid out. So each one of those had its own unique challenges around how to keep people safe, healthy, and of course the risk management from a business owner's perspective, that if the Ministry of Labor comes in, or God forbid you have an outbreak somewhere in the business, that your employees feel safe and are safe, and secondly, that your business is safe in the sense that you're covered from a risk management standpoint. So again, we got it on it quickly. We were fortunate to have a third party already engaged, and the policies built accordingly.
Any challenges in maintaining at this point?
The biggest challenge I find is the natural human instinct to want to be close to one another. Right. So whether you're grabbing a coffee at the coffee machine, or whether you're on an assembly line, the natural instinct is to come close together. And so that's the distancing is the most hardest thing, because it's so unnatural for us as people to be disconnected like that. That's our biggest challenge.
So how do you deal with that challenge?
We the managers walk around and tell people to stay 6 feet apart all day. that's basically we've nominated one person in every location. We run 6 locations, so in every location, somebody's responsible to enforce social distancing.
Okay, Alan, you're next.
Carry the big
tell us a little bit about your experience. You're muted.
I think a little bit like Jeff is it on now? Yeah. A little bit like Jeff, we're fortunate enough and have taken health and safety serious over the years. and always treated our we've been in business almost 30 years, so I can be honest and say for probably the first 15 years, it wasn't as important as it was in a lot of years, or as your business grows, risk management becomes a way bigger responsibility. So it's been part of our culture for a while, but it's a living document. So in that sense, we're constantly reevaluating. We're constantly trying to stay up to date with what the government is talking about, not just with COVID-19, but with everything. This has been unique in the sense, one, it came on so fast. So evaluating your policies and procedures in the moment versus having a planned approach is now suggested with an annual review, or you get the trickle of government implementation, new programs. They usually have lots of lead time. So this has been a rapid evolution in health and safety. Just the very early days of workplace safety and prevention, putting out COVID prevention checklists that came out, and going through it, thinking we had a pretty robust health and safety program, to realize in the context of an infectious disease, it isn't as robust as it could be. So that was the first piece of it. I think the second piece, from an operational standpoint, that's the easier piece. It's that human element that Jeff talked about that's been our challenge. And maybe even Natalie could talk a little bit about the maintenance and management of it as your workforce, and you dealing with that human element. We all know that the government's put in place that if anybody shows symptoms within the workplace, they're not to attend work, they're to notify their employer, and they're potentially going to self-quarantine for 14 days. Plus, there's this whole piece the government keeps talking about tracing. So where do we go back? Who do they come in contact with? How do we manage that? That's probably our biggest gap right now. How do we get them back to work? How do we manage them while they're off? When do we need to get doctor's notes? How do we need to progress it? And how do we build the confidence back up? Because a lot of times these symptoms show up someone calls in sick on Tuesday. Well, the people that have been working in just case in a greenhouse, our case in a crew, or in the shop or in the office, they've been working with this individual for the past 3 or 4 days. How do we reinstill their confidence?
Yeah.
Great question. Yeah. So Natalie, you're on.
Yeah. No, that's a good question. And a lot of people have that question. And I mean, I've been saying this, and I've been saying this saying for the last 2 months, is it's better safe than sick. And it's so true, because you just got to make sure that you're not going to spread it within the workforce. So any symptoms at all of COVID-19 symptoms, mind you, because this is also allergy season. And I know that's hard because a lot of people are getting their normal allergies that they usually do. But unfortunately, the COVID-19 symptoms are very similar to allergies. So I just want to make sure that everyone knows that the way you say it is really important, because you don't want to freak out the rest of your workforce. So the best thing to do is when anyone has any symptoms, you have to ask them to go home immediately. And of course, be very sincere about it. I just want to make sure that you're safe, that your family's safe, and we do the right process. And you could even say, Health Canada has told me that any symptoms that are in the workforce, I do have to unfortunately send you home. This is an unpaid time off, but they can apply for the quarantine period under EI. So they still do get that period of time that they can get the amount from the government, so that they're not left with any money when they are at home for that 14 days. And they're saying that if the symptoms continue or they get worse, you have to call the Health Canada helpline, and they're going to guide you through the whole process. They're going to tell you whether you need to get tested or not. They have some screening questions on the phone, and it's Health Canada's responsibility to help the employer map out what happened. So who are they in contact with? So they actually really do help you step by step along the way. So you don't have to worry too much about the process in terms of, okay, I have to now map out every single person that this person was in contact with. So they really do help you with that. But with that being said, if you know that they may be carpool with someone, or they work really closely in one small area with a bunch of people, it's the employer's responsibility to let the workforce know. And you have to tell everyone, not just the people that you assume that they've been in contact with. Because for disease protection, it is their right as a human to know that they may have been in contact with COVID-19, especially if they may be bringing it to their family. So you do have to let the workforce know as a whole if they were tested positive, not if they have symptoms, if they were tested positive. So that's why it's really important for them to monitor their symptoms, keep you up to date as an employer. If the symptoms increase, get worse, or don't go away, because we know allergies come and go, whereas COVID-19 is not the case, right? So they do have to get tested. And once they have that positive test result, you do have to let your entire workforce know. You cannot disclose the name. This is a personal and sensitive matter. You're not going to say Natalie Hansford tested positive yesterday or whatever. You would just say an employee in X department that works X shift was tested positive for COVID-19. So we ask that if you were in contact with this person between the last 14 days, because you have to go back 14 days, and let them know of that matter.
Oh, that helps, Natalie.
Yeah.
Thank you. The other piece that, Tony, I just wanted in our policy, I think Natalie alluded to a little bit, and probably helpful for those on that are participating today. The special tasks. So when we're doing things where we're inside that 2 meter, we have special policies and procedures. One of the big ones is in a vehicle. So we've set policies that we expect our staff to maintain when they get inside that 2 meter buffer. Probably the same is true for landscape contractors. If you're moving interlock brick and you have to be within a couple feet of each other, that these things outside of the 2 meters, we have a policy. In our case, because we're outside, we don't require employees to wear masks when they're away from the public, when they're working by themselves. But the second they get in close proximity to each other, to Jeff's point, where they can't avoid or just a human tendency to congregate. So in our shop in the morning, everybody wears a mask in the shop before they leave. When they're in a vehicle with any coworker, they're wearing a mask. They have a mask on them on a job site, so if they come in close contact with another employee or a member of the public, a client comes up to them and needs to be in close proximity, they have the ability to don a mask again. So that's within our specific policies and procedures to deal with those situations that don't meet the overarching policies. I don't know if you have anything to add to that, Natalie.
Yeah, so specifically with trucks, and I spent some time actually last week developing a policy that was specific to trucks because we got a lot of questions on that. And you have to make sure that you're sanitizing the truck before and after use. It doesn't matter how long you were in there, who was in there. So you're absolutely right with having the PPE for the employees, so the mask. They can wear the safety goggles if they wish, only because they're saying that if you're going to be in contact with someone that's within that range, you may get it in your eyes too, right? So they're saying that you might actually want to wear the glasses as well. But if you're in a truck, I don't see a problem with that. But you have to sanitize the truck before and after use. So even if you're only in there for 5 minutes, and each employee sanitizes their own side, and then even when they get back in it and at the end of the day, they still have to sanitize it before they leave. So that's really important as well. And then, of course, giving them that, making sure that they wash their hands or they use the sanitizer before and after they get in the truck every single time. So they have to do it right away before they get on site or before they go anywhere. They have to use this after getting out of the truck as well. So that's another 2 things that I would add to that.
Natalie, while you're on trucks, how many people can be in a truck?
So they're saying... do you know what? It's a very loose question because they're saying that the only people that should be in a truck are people that are in the same housing, but that's not always going to be the case. So they're saying anyone within a 6.5 feet distance, you have to wear PPE if you're going to be in a surrounded area. I would say I wouldn't go over 2. I really wouldn't. They're not saying that there's like a specific number. I'm sure they're going to update it again as the weeks progress, but I wouldn't go over 2 people. I know that it's going to be a little bit challenging for people that like to staff up in a truck, but keep it to 2 and make sure that they have their PPE while in that truck. But it's supposed to be anyone in the same household on a normal commute.
Thank you.
Yeah.
I'd like to go to Peter now, and just Peter, can you share your experiences with your policies and procedures and implementation?
We went through the safety groups program at EIO several years ago. So we got ourselves into the habit of developing our safety policies and reviewing our safety policies. We have Joint Health and Safety Committee elections every year. So when this developed, we were pretty quick to update our infectious disease policy, and our Joint Health and Safety Committee members were very effective on this, especially when they had this shelter-in-place order. They basically had one task to do, so we got that thing produced and turned around pretty quickly. We have had to update it a few times. We as a company have offered wages to our employees when we send them home if they're suspected or have COVID, and that is entirely due to the wage subsidy that the government has provided. So that helps us a lot in terms of incentivizing people to make safe choices. And the program is very generous. The government will pay 100% of their wages up to 75% of their pre-COVID wage. We did our first application last week, and we've already gotten our first payment from the government. So I have to say it's going to be instrumental in successfully navigating through this. In terms of our safety policies and the actual implementation of them, all the challenges you guys have indicated are real. Jeff doesn't like the safety programs. I'd say it's a lot like exercise. You know, it's not a lot of fun necessarily while you're doing it, and the benefits may or may not be visible in the future, but there are benefits and they're real, and you have to trust that it is making a difference. And in terms of enforcement, it's very difficult. As with all of our safety policies, it's constant, steady pressure. If you let things slide, then employees will take advantage and do what's convenient for them or what's comfortable for them. And you have to have a culture of caring, where people, if they don't want to do it for themselves, they have to understand they're doing it for the people around them and their families. And in terms of the 2-meter social distancing, most of my crews just wear masks all the time. I mean, it's because what happens is on a job site, you don't expect to walk near somebody or be near somebody, but 2 seconds later you turn around and there's somebody right there, and it's almost unavoidable. It's easier just to constantly wear a mask. And I know that's going to be a bigger challenge in the heat of the summer, but if we can develop those good habits now, I think it'll be easier to maintain them through the difficult heat in the summer.
So Peter, have you thought about how to mitigate the risk if somebody in your operation gets COVID? How to prevent it from spreading to other crews and so forth? Or what are you doing?
We have taken 10 steps backwards in our company culture development, and we've created silos. I know that's a horrible word, but our crews now are silos, and our crews don't interact with each other. We don't have yard meetings or group meetings anymore outside of individual crews. All of our stuff is online. And then the individual crew leaders are responsible for conducting the tailgate meetings and the safety meetings on site and doing the site safety meetings. So if something does happen, much to Natalie's point, if somebody does test positive and we have to notify anyone who's been in contact with that person, it will be a limited number of people. So we have 7 crews, and if I can limit our exposure to 1 crew at a time, we can probably manage our jobs in our company through that type of disruption. I mean, it's like you said, it's a work in progress. So we'll have to constantly update those policies.
Right. So you thought it through. David, your turn. So tell us a little bit your experiences with policies and procedures and implementation and maintaining and challenges.
Sure.
Okay.
So we've always had lots of policies for dealing with health and safety. dating back to early 2000, the late 90s. We were involved in safety groups. So that really pushed us into having that stuff together, and continual involvement with the safety groups has made us update them numerous times over the last 25 years. There was the days before safety, I remember them well, where it was not the first thing that came out of your mouth, where it is now. So certainly my team works through the health and safety. I have a health and safety. We have about 30 employees here, so we have a health and safety committee, and they we regularly review those policies. So when COVID-19 came along, we were able to identify that we needed a specific policy. We are clients of EIO, so we started down that path, and then had EIO put those policies together for us so that they were written properly and legal and so on, and we implemented them immediately. But like we talked about before, you have to keep updating them. Like, things are changing on a daily or weekly and daily basis with the government. You have to respond to it, and when you hear something has changed, you need to update your policies accordingly. So certainly, like we talked about drivers and vehicles, we started off with one person per vehicle, and within weeks we were at 2 people with a plexiglass shield between the driver and the passenger. So, but we still have to make sure that the people in the truck are wearing their PPE and doing the proper wipe down and so on, the sanitization. So, staying on top of that constantly. Looking out my office window at the yard when there's a guy at the gas pump and somebody walks up and starts talking to them. Well, I got to get up and say, hey, you got to stay 6 feet apart. And when you've got crews that are very familiar with each other and have worked together for a number of years, and they're friends, it's hard to keep them apart. But we have to be diligent in doing that, and it becomes more of an observational thing where the managers and the supervisors need to walk around and watch for it, and watch job practices and make sure that what they're doing in the field is what we say we're going to do, because that's half the problem, is that you can have all kinds of policies, but if you're not actually practicing it. So that's certainly something that we're looking at right now is making sure that we are actually following those policies, and it becomes a regular, I wouldn't go so far as to say an audit, but it's regular observation of how we're doing things and are we doing it properly.
Thanks, David. There's some questions
Tony,
here about.
Tony, can I just add to Dave's comment there? I think it's important that part of the task force's goal was to maintain that news cycle. So this is a daunting task with the daily and weekly updates. And the team at Landscape Ontario, with Sally's help, your help, Tony, and then the daily reviews, we have a big part of that, and we'll continue to do that. Maybe as we get a little bit more into the busy season, it'll be behind the scenes, but updating the task force website with these policy changes as the government's constantly dealing with this. One of our objectives and goals as a group here is to bring that information as quickly as possible to the memberships, so that allows us on that weekly basis to know there's a point where we can go get as much information as we can, but it's still incumbent on us as business owners to also be aware of the news cycles where we're getting updates outside, and then having a resource to go see if it's been disseminated again by their peers and by those that are watching on a daily basis that are maybe busy out in the field. And the likes of, as Dave alluded to, hiring a consultant is also another means to do it. So depending on the size of your company, you may have that in-house. If you don't, then obviously we know our membership's made up of a lot of small operators. So if we can be a resource to them, it's one of our ongoing goals as we move forward.
Thanks for bringing that up, Alan. And that on our website, there are a lot of resources, even in dealing with policies and procedures as well. And I know EIO is helping a lot of members too. There's some questions here about how to deal with subcontractors. Who wants to deal with that one? Peter, do you have a lot of subcontractors? Dave?
Well, maybe if Natalie, Tony, could just what the policy should be, and then how we're dealing with it. Because a lot of question comes up when you're dealing with a subcontractor. I have my own policies and procedures, I have my employees sign off on it, but what's our responsibility as employers the second we hire a subcontractor to ensure that their policies are consistent with ours and their employees are protected?
Yeah, so absolutely. That's a good question. And if they're your subcontractors, whether they're like on an individual basis, so individual contractors or like a company that you're hiring, they still have to follow your policies and procedures when they're on your site. So a great way to come about it is making sure that you communicate with them like, hey, we just updated our policy. If you want to use it, feel free to, because this is the policy that we're using on our site. And if you're not following the policies and procedures, you can't be on our site. And that's really important because making sure that they're not going to, like I've gotten this a lot where employers are getting really frustrated because they're on site with a bunch of other companies and they're not following any of the rules. And that's going to actually put the jeopardy on you and your workforce as well. So making sure that they're following the policies and procedures, and if they don't have one and they don't know what to do, offer it, because the best case scenario is that they follow the same policy as you and you're all working together. So that's what I would recommend with making sure that you're protecting your workforce as well. Subcontractors, they don't get a bypass. They have to follow the same rules, and you have every right to protect your workforce and force them to do so, or else get off the site. Yeah.
I think that's a great differentiation there, Natalie, is the fact because I think a lot of us, just looking at the comments on the side, run under the perception of as long as they have a health and safety policy and they provide us with it, that we're covered. But in reality, they actually have to follow. We should be providing our health and safety policy to them because they need to follow ours.
Yeah, that's what I always recommend, especially if you know you have the most up-to-date COVID-19 disease protection, all that great stuff. Share it because it's going to help you and your workforce for sure. Yeah.
So we work for a lot of general contractors doing landscape work on large sites, and so we're often given or requested early on in the project, what is your health and safety policy? Certainly, when the COVID-19 pandemic hit, we were still working. Our general contractors asked for our COVID-19 health and safety policy. They also gave us theirs. What the policies were for some sites, we have to check in. We're working at some long-term care facilities. We have to check in when we go on site. So they've got their site-specific policies. But what I've also talked with my crews about is how the other subcontractors are dealing on the site. And obviously the general contractor is in charge, but seeing how different trades do things differently, and ultimately the general contractor is responsible for everybody on their site. So when you are the general contractor, when you've got subs working for you, you need to ask your subs for that documentation. And if they don't have it, they need to follow yours. And you need to be strict about it. You can't have some roofing guys working on a pool cabana and with no PPE on it. Just like it would be if they're not wearing work boots and safety goggles or anything like that. So it's important to this is not to make light of it, but this is just another health and safety issue. This whole COVID-19 crisis, the same as what it was. Like I talked about before, about the days before safety, and just trying to get guys to wear work boots coming to work to cut grass, because back in the 80s it was okay to walk around wearing running shoes while running a lawnmower. So it's that kind of thing. This is just another safety issue that we need to deal with.
Yeah, and I think another thing to keep in consideration is that if you are one of those subcontractors on site, employers are calling employers into the MOL. And they're actually having that somewhat more than employees right now. So making sure that anyone can call it in, whether it's a client, whether it's another employer, whether it's an employee, whether it's just an observer that's walking by, people are calling in left, right, and center. And some employers are actually calling on other employers because maybe you don't want to have that confrontation. Maybe you don't want to deal with it. And if it's really come to that, you can do that. And I know that's not really the business adequate that we usually deal with, but COVID-19 is serious. And if it's going to protect you and your workforce, sometimes you do have to make that decision.
Okay. Peter, have you had experiences with subcontractors?
So the last time I did an outdoor webinar a few weeks ago, I discussed a steel structure that was being put together, and that subcontractor did not work for me. They worked for the general contractor, as to Dave's point. And we did notify the general contractor that my crew was uncomfortable with their lack of safety protocols, and the general contractor did have a meeting with them and has instructed them how to work safely, and they did have to start conforming to the site requirements, and that brought a lot of relief to my crew, and that's that's what's important to me, is to make sure that my crew can be safe and willing to work and happy to work, and they have to feel safe to do that, and this is going to happen probably all summer long, where you're going to come across people who have given up they've been doing this for so long. It's been such a pain. I hear stories now about people going visiting other people. Doug Ford's daughters went to visit him, and if he can't do it, it's just the whole system's going to fall apart. So it's going to be a constant maintenance of safety procedures, and I think subtrades are going to be a challenge. In every job, I'm going to come across a new subtrade that has their own level of compliance, and we have to establish what we're comfortable with. And when we're in charge, when we're the general contractor, I have authority over the other trades, so it'll be easier for me to enforce. But when I'm a co-subtrade on a big site, like we have sites like Dave said, big commercial sites, it's going to be much harder. But those big general contractors have a lot more to lose if the MOL does show up, or if somebody does come down with COVID and everyone has to self-isolate. So they have an interest themselves in keeping the site safe. So that's maybe some small comfort, that if you do voice your concerns to the general contractor, they will go to bat for you.
Thanks, Peter. Let's
Tony,
answer.
Tony, there's a bunch of questions. Yeah. There's a bunch of questions here around protocol. I know we only got 15 minutes left. Protocol around people getting sick. Maybe just from some of the others here. I know Peter mentioned in a great way of looking at using the wage subsidy right now as a way to help employees out when they have to go into self-quarantine. But maybe Natalie could expand a bit on when the rest of a team or the rest of your bubble needs to go into self-quarantine once someone is. The fact of, you're right, about allergies and other symptoms. So there's a point where they just don't come into work, but at what point as an employer do you escalate it with the rest of your work team? And then just maybe from the rest of my peers here, as Peter alluded to, some of the ways we're dealing with it to help employees, but the government programs are assisting us.
Yeah, so I know that allergies are one thing and COVID-19 symptoms are another, but I'm talking about obviously if it gets worsened. So if they have any symptoms at all, first of all, you don't want to freak out the rest of your workforce if someone's coughing everywhere. Regardless of whether it's COVID-19 or not, it's going to make stress on all the employees that are working with this employee. It's not worth it. So you really do have to get them to self-isolate for those 14 days. And if it gets worse, then they do have to get tested. You only tell your workforce when they're tested positive. Don't freak them out when you don't even have an answer from Health Canada on whether it is positive or negative. Because again, it might be just a cold. The weather we got snow the other day. So they actually may be just getting a cold, or they may actually just have allergies, or whatever the case may be. So don't freak out your workforce with having someone who's coughing everywhere, especially just send them home. But with that being said, if they are off, they can apply for EI. So if you're not applying for the wage subsidy, that's a great alternative. And a lot of people are doing that they get that 75% of their wages before COVID-19. But if you didn't apply for that and you don't plan on applying for that, then the employees can actually go on EI for the 14-day quarantine period and they'll get paid that amount.
How does WSIB play into it? Because there was a bit on one of the calls last week, because WSIB, I think, is really struggling with when's it a workplace sickness versus general circulation. I think it's going to be really difficult to cover off in this case if it actually came to reality and putting a Form 7 through.
Yeah.
But also a question around the other employees too. Do you have any insight, or have you had any experience with some of your other clients?
Yeah, so we actually called WSIB like the first week, I think, when COVID-19 kind of was starting, and we wanted to call them directly because you're going to get the information correctly if you call them directly. And at that point in time, they were basically saying it's really hard to say that it came from the workplace. Now, if there's an outbreak, that's a completely different situation. But if there's like a one-off or two-off employees, it's going to be quite challenging to prove that it actually happened in the workforce. So with that being said, they actually have an illness and disease protection policy saying that unless there's like a massive outbreak, it's not WSIB related. But if you can prove that maybe they've been carpooling or whatever, like the same group or department all kind of had that outbreak of COVID-19, that's a different situation. But of course, if there's like the one-off or two-off, they're saying, WSIB is saying that they can't actually prove that it was an outbreak in the workplace. So, I mean, I would say every situation is different on whether you're going to put in that Form 7 or not. But if it's just one or two employees, you could always do it, but it's not always likely that it's going to be covered. Yeah.
Thanks. Tony, I can share with the audience too, the fact we had an employee that did go 14-day self-quarantine, symptomatic, had a direct contact, though not tested with a COVID, two COVID patients. They're actually family members. At the end of 14 days, they were still symptomatic. So this employee went for another week, still not tested. Upon coming back, so this week he phoned in and says, you know, I'm feeling better. I want to come back to work. We asked for doctor's notice for coming back. He'd never been tested, but because of the length of time he was off and that his symptoms escalated and he went past 14 days, we put him, now the doctors won't sign off on the fact that he was off for so long and he has to go get tested now. I don't know if you have any experience with that, Natalie. It's just one of those awkward, what is the right point? We originally, our policy had 14-day isolation, 24 hours symptom-free before returning. And if you still had symptoms at the end of 14 days, that you needed to get a doctor's note and be symptom-free.
Oh, for sure. So they're saying that they want you to be symptom-free for 14 days, right? So you don't want to make sure that the employees aren't coming into the workplace, even though they're 14 days isolated. Everyone's handling COVID-19 differently. So I don't want to say that this employee has it because I'm not a doctor, but everyone handles it differently. Some people have it for months. Some people have it for 14 days. So you really can't decipher on that 14-day period. You have to be symptom-free for 14 days, meaning you have to actually pass it through your system. So absolutely that employee would have to be tested. And just based on the protocol that the doctors have, then that's what they're doing across the board in Ontario.
Thanks.
Okay, so Natalie, I just want to make sure we've answered Carl Hastings' question here.
Yeah.
If one person gets sick, what happens to others that work with that employee? Are they told to stay home, or do they work alone, or does everybody on that crew go on EI or on the other program?
Yeah, so I think I would go back to how I answered the first one, is always make sure you have that positive test result. And that's why it's really important that, say someone does get sick in the workplace, they go home, they monitor the symptoms for the first 2-3 days, and if they continue, go get tested, right? But that's why it's really important to make sure that you have the PPE when they're within the 6.5 feet distance, that they're not within 6.5 feet, and there's social distancing. They're washing their hands consistently. They're sanitizing their work areas, and they're following all the policies and procedures. So it's one thing to potentially have someone that's having allergies or sick in the workplace, but making sure you follow those policies and procedures so it doesn't have the outbreak. They have those rules in place so that if there is someone in the workplace, no one's going to get it, right? So making sure that you're following those policies and procedures if someone is potentially sick is really important. And that's the first part of what we were talking about within this webinar, is that just making sure that those are in place. But with that being said, if this person is tested positive, then completely different story. You do have to handle it differently. You do have to communicate to the workforce, but don't freak out your workforce when you don't have a positive test result. But continue to have those isolations and social distancing practices, PPE, wipe downs, all that stuff.
Okay.
Yeah.
I know we're kind of repeating some of these questions, but they come in from different angles. So Carla says, we have a staff member that called in today and said he has a cough from working in the snow yesterday, but wants to come back to work tomorrow. How do you handle that?
Yeah, so unfortunately, they won't be able to come back if they have a cough, right? This is one of those better safe than sick, unfortunately, and I know it sucks because this could potentially happen to a lot of the employees because it was snowing 2 days ago and now the sun's out, and of course people are going to get colds. So I know it's not the right answer that you want to hear, but unfortunately they do have to isolate if they do have a cough.
Now, is it possible? We got instruction from our doctors. We've had a few people like either got the flu or a cold. So what we instructed them was immediately stay home, go see your doctor, and if your doctor says it's okay to come back within the 14 days, I need a note.
Yeah, so you need confirmation.
That work around so it's not a mandatory 14-day isolation. Yeah. If you're in that and you think you just have a cough, you need to go see a doctor, otherwise you're off for 14 days.
And what I think a lot of people are forgetting that is people are still sick. So if they have a flu, if they have a cough, you don't want them in the workforce anyways. You don't want them spreading this cough or flu or whatever it is. So don't forget that there actually is still flus that people can spread. Before COVID-19, if someone was sick, you didn't want them in the workforce. So you don't want them in the workforce now, especially if it's going to bring stress to the rest of the employees.
Noreen's asking, she wants a clarity on whether you can ask for a doctor's note, even if it is an allergy or a common cold. Elijah?
Of course, you can ask for a doctor's note. They put it back in the Employment Standards Act that you're now allowed to ask for doctor's notes. They're saying that if someone has COVID-19, that the doctors aren't giving doctor's notes. They have to actually have that negative test result. But if it's a common cold or flu, then I would say yes, because it's in the Employment Standards Act that you're allowed to legally ask for doctor's notes.
We call it a little differently, Tony. We call it a return to work note. So we don't ask for a note to be off sick. You can go off sick for any reason you want, but you can't come back in and circulate with the rest of the workforce until you have clearance. So we kind of approach it, we flip it. Even before, when you couldn't ask for a doctor's note for sickness, we said fine, but if you feel it's sufficient enough to be off work because you're ill, we need to know that you're okay to come back to work. Yeah. So it's just, I think, changing it. One is to deal with the legality. Two is to make sure as an employer that you're responsible for the safety and well-being of all your other employees. So we want to make sure, particularly in light of the current situation, that person returning to work is legitimately able to come back. And we're not doctors as employers, so we want to make sure that somebody that does have that knowledge and experience has the ability to sign off on them before integrating back in.
Are any of you having an issue of employees afraid to work? Not wanting to come back?
Not with good protocol. Like, again, our protocols in the VM every week, and anytime an employee does have a concern, we deal with it right away. And if it's legitimate, it actually becomes part of our policy, to Dave's point earlier, within the day or within the week. And if it's not, then we reassure them by answering the question. Jeff, you have some?
Yep.
Yeah, we have about a third of our employees that have not come back because they're nervous, afraid to work, even though we have very good policies in place. I think there's twofold. You've got employees that are nervous about coming back, and then of course you've got a lot of childcare issues that are causing folks not to be able to come back. But certainly there's still a large fear out there of being anywhere where there's other people other than your family, being outside of your home.
We had an issue with that early on. We had our construction crews working throughout because we were working on some of these bigger jobs. We did take a short pause to get our policies in place, and then got back working again. And there were a couple employees who decided to go home and stay off just because they were afraid for their families. They were afraid of the thing. But through further communication and communicating our policies effectively and actually practicing them effectively, after a few weeks they came back to work again. So it just came down to proper communication that yes, we can do this, and having the attitude that yes, we can do this. I've been pushing right from the very beginning of this that we need to become safety companies that do landscaping, and I think we need to be the ones out there that's showing the other industries that we can still go here and work and do our jobs and be safe and carry on and be just as efficient as we ever were. So let's all be that company.
All right.
Yeah, we added to ours a little bit, Tony, at the beginning, that because there was some apprehension when the premier did relax for this sector. But the way we dealt with it was we came in slowly. We brought in all our employees' comments. We actually include them in the conversation because as an employer, the way we approach this is the new normal. This could be the new normal for the next 12 months, 24 months, or beyond, as infectious disease now becomes part of it was never top of mind other than maybe the occasional flu prior, but now this is mainstream health and safety now. So as I expressed to my team, we need to figure out how to, in our office, in our operation, in the field, we need to figure out how to do this and then maintain it for the foreseeable future, because this is going to be our new norm. Whether the infection's here, we know somebody that's sick or not, we know the disease isn't going away.
Yeah. Thanks, Alan. We've got time for one more question. Samantha Nixon asks, what recourse does an employee have if they feel coworkers and management are not following policies and procedures?
Yeah, so there's a certain process that, of course, you have to follow. So if an employee is refusing the right to work, they do have to be on site when they do that. So with the 3 worker rights, that one of them is they have the right to refuse, and they do have to have the right to refuse unsafe work due to COVID-19 as well. But with that being said, there is a procedure that they have to follow. They have to be on site when they say that. They have to actually physically see it and see that they are unsafe at work. Then they have to do a hazard analysis. So you'll take a look at the workplace and you'll actually go through it with your Joint Health and Safety Committee and actually go through the actual analysis of whether it is deemed unsafe or safe. If you deem it safe, then the employee does have to remain and go back to work and start working again. But if the Joint Health and Safety deems it unsafe, or the employee again says, I have the right to refuse, then sometimes the Ministry of Labor will have to come on site and make that call for you.
Super. Thank you, Natalie.
Yeah.
And that concludes the webinar. Thank you, everyone, for spending time with us. It is inspiring to observe the sense of community that comes out of a shared challenge. It is wonderful to see so many of you step up to help each other. I want to thank Landscape Ontario's COVID Task Force for all their work and leadership. Alan White, Jeff Olson, John Dursey, Dave Wright, Peter Ganane, Margot Byers, Terry Childs, Lindsay Ross, and James Riddell. They've met 35 times so far and are focused on helping you deal with this COVID crisis. Thank you, Natalie and EIO for your weekly webinars and for your knowledge and help. Thank you to the LO COVID Retail Task Force, Mark Cullen, Frank Vergini, Jeff Olson, Lorraine Johnson, Rob Vandercrook, Terry Vandercrook, Jennifer Llewellyn, Paul Zamet, Ben Cullen, and Sean James. This amazing team of garden communicators, growers, and retailers delivered massive press, effective government relations, and great results. Finally, I want to thank our Landscape Ontario, CNLA, and Canada Bloom staff family. We are focused on helping advance the landscape profession. It's time to work. It's time to work safely. It's time to show who we are as landscape professionals. Happy spring. Bye-bye, everyone.